Go.
Okay, you have the hyoid bone, and then you have C1 through C7, which are the cervical vertebrae. You have the spinous process and the transverse process. And then you have T1 through T12, which are the thoracic vertebrae. You have the intervertebral discs and the intervertebral foramen. And then L1 through L5 are the lumbar vertebrae. And then you have the sacrum, which is 5 vertebrae fused together, the coccyx, which is 4 vertebrae fused together, and then you have the sternum with the manumbrum, the sternum angle, and the body. You have the jugular notch, the clavicle notch, the sternal joint, the sphiroid process, and then you have 1 through 7 are the true ribs, 8 through 12 are the false ribs, and then 11 and 12 are the floating ribs. You have the clavicle and the scapula. The acromina connects to the clavicle, and then the acromina clavicle joint connects the clavicle and the scapula. And then you have the humerus, which articulates with the ulna, which articulates with the radius. The ulna is the medial part of the forearm, and the radius is the lateral part of the forearm. And then you have the bony pelvis, which comprises the pelvic girdle, the sacrum, and the coccyx. And then you have the femur, which articulates with the tibia and the fibula. The tibia is the medial part of the leg, and then it is also the larger part. And then the fibula is the lateral part. And then at the proximal end, they receive the distal end of the femur, which forms the knee joint, and then you have the patella.